This is our Goa CARES 2025 Goa Cohort for Assessment of Risk and Epidemiology of Non-Communicable Disease Study. So we have given them a short form Goa CARES 2005. Three stakeholders. One is the brainchild of Director of Health Services, DHS Goa, Center of Cancer Epidemiology, Tata Memorial Center, Mumbai, and Newfield Department of Population and Health, University of Oxford. So we all three stakeholders will come together and have the next slide, please. So we have selected about 1.2 lakh cohort study. Cohort means the people who will be actually, is in the. But demographies we have taken from Walpai, one area, one Sakri, because of municipal as well as this area, Panchayat area. Then we have taken Margao plus coastal belt, so that coastal area also is covered. And one is from Konkani, because we have seen Konkani there is a lot of kidney problems and other things, so we will be able to identify what are the causes. We will enumerate around 3.3 lakh of population. Out of that we will select 1.2 from the age group of 25 to 70. And we follow them for next 20 years. So once we enumerate them and identify them, we will call them to the CSC or nearby center, do their all height, weight, BMI and other things, blood test, regular blood test. Then we will take a sample, freeze and send it by 2 to 8 degrees to the Tata hospital, where they will freeze it at minus 80 degrees and they can store that for next 20 years. So anytime in future we want to do some study on genomic or something, they can do it in that facility. So there are roles and responsibilities we have taken. DHS Goa, which is important that we will look after all the how to go to the respective households and collect all the data. CC TMC will give a design study methodology, storing of that this, and in future suppose we want to do any studies, they will help us out. And Oxford University will give us a study design, support data analysis. We will integrate some risk factor, enable research collaborations. Suppose tomorrow we require some funding, then all three of us can apply for funding, and so we can give a grant for some particular. Suppose we want to study some genetics in diabetes, or we want to study some genetics in breast cancer, then we can go back and take all these samples and study. So we will be having around 1.2 to 1 lakh to 1.2 lakh cohort blood samples stored at the biobank of the Tata Memorial Hospital. Thank you very much.
Now I request Dr. Sarah to come forward and speak about the role assigned to the Oxford University and how she will fill us out.
Well, thank you, and I just want to start by saying thanks very much for the invitation to join you today. It's a very warm welcome I've received from everybody. So I'm a Professor of Epidemiology and Medical Statistics in Oxford, and I've been collaborating with Dr. Dixit and Dr. Matre and their colleagues on the Indian study of healthy ageing in Barshi, providing, as we've said here, the sort of academic and technical support through exchange of knowledge and increasingly personnel, including students. It's a study of rapidly evolving lifestyle, environmental and lifestyle causes of disease. That's what's going to be really important here. India is the largest population in the world, so it's just a wonderful opportunity for Goa, for India, for the whole of South Asia and globally to add, I think, important evidence to our global understanding of disease. And we would love to support you in any way that we can. Thank you.
Thank you, Dr. Sada. Now I will invite Dr. Dixit to give a Hawkeye perspective view of this whole project, so that how we will be benefited by this project.
Thank you very much, Honorable Respectful Chief Minister of Goa, Chief Secretary of Goa, and Additional Secretary of Goa, and all the dignitaries at the dais. I think that this is a very historical moment, and what we are saying today and what we are starting today is a landmark study, and it will understand the lifestyle, environment and genetic basis of chronic diseases, not only in Goa, but it will contribute to India specifically. Whatever we learn from here, it will contribute to the India and then also globally, because there are many exposures which are very particular to the Goa and which are not present. We can't study some of those exposures outside Goa. So therefore this study is very important. Some of the prevalence of the exposure is very high, that we have to study. So for example, just last week, Honorable Prime Minister Mr. Narendra Modi, while speaking in Gujarat, said that the obesity prevalence is very increasing, and he also suggested that we have to reduce the oil consumption and this thing to control the obesity. So that's a one very important message that he has given and showed the consent about obesity. And in Goa, I assume that the obesity is one of the very big problems. You know, there are very large proportions of individuals with the obesity. And what this study will do is when we will measure the obesity at the longitudinal different points of the time, we can actually identify what could be the biomarkers to prevent obesity also. So there could be not only the environmental factors, but there could be the genetic factors also. So once we identify those factors, this will help and facilitate to develop some precision medicine to control the obesity. So this is the potential of the study. I'm talking about the potential. Similarly, just I think 1 month back, the Prime Minister of India launched the Genome India project. So in Genome India project, they had 10,000 sequence data, and out of that 5,000 it is open source data is available. But in that Genome India, the Goa is hardly represented because it's a very small state, and but it has a very huge genetic diversity in Goa. So I think so if you have the 1,000 genome Goa project somewhere, which is possible here potentially, then you can have various sequence which is done from the Goa and which could contribute to whole Genome India project. The contribution of the Goa thing that could also be done. The third very important aspect which I see here, the potential, is to detect the chronic diseases early. Because in this project, what we are going to do is we are also doing the biochemistry evaluation at this time of the blood collection. So we are not only storing the blood samples in the biobank for longer time, but immediately we will do the lipid profile and the renal profile of the individuals. So this gives the opportunity to immediately tell the individual that you have probably the early signs of the kidney diseases, or you have the higher level of the lipidemia is there. So go to the and we can refer them and do the proper intervention. Similarly, in this cohort we are also screening for the oral and the breast cancer. So this will also help us to detect the early cancers. So even before we do the follow-up and even before we get some linkages of the risk factor study, there is an immediate intervention should be possible, which would be also very helpful. So when we do this study and when whole machinery moves to formulate this cohort thing, the many things will also develop. For example, there will be good community interaction. So there will be good face of the DHS and the government of Goa, that how the government is caring for the health for the people. So there will be very good community interactions and good community participation will be there. And because we are giving the biochemistry reports to them, immediately they will be benefited for the intervention. And this process will also help to build up a good follow-up system by the passive follow-up. So, and then this will helpful for the developing a good electronic medical record maybe. So we can identify the areas where we are lacking at this time, because we want to move towards a digital India. We want to make our medical record completely digitalized and electronic. So maybe when we do the project and when we start doing the linkages, we will identify the areas where the electronic medical record needs to be strengthened and build up an IT infrastructure to have the good electronic medical record. And then there could be a large amount of downstream applications would be there. So I talked about the obesity, I briefed about the markers for the obesity which we can identify, and we can also identify the individuals who are at a high risk of developing the diseases in this state. So overall, I think it's a very landmark study, and in the process, it will help us to identify the risk factors, but we will also develop the good digitalized electronic medical record, IT infrastructure, and how to do the passive linkages, as well as improve the causes of death. Because when you do go follow up and if you find out that you don't have nice causes of death there, maybe we can also try to improve the cause of death registration in Goa. So this would be a side effect, let's say, of this study. So this is what I want to say. And thank you. Yeah, and of course, this data will be compared with the Barshi and Varanasi, where we have already started. And so this could be a comparable, and then globally we can compare with Oxford and the Mexican cohort, the difference of the risk factors and identity factors. Thank you very much.
Thank you, Dr. Dixit.
There are two pillars for this project, DHS and our Goa Medical College. So I request DHS to say a few words.
So, good morning, sir. And it's a pleasure being on this platform to say that it's the first time we are having a longitudinal cohort study. From my desk review, we have not done any survey or some in this field, but to my knowledge, 25 to 30% of the Goan population are suffering from non-communicable disease. And we come to know when the complication sets in, like a cardiovascular disease, stroke, chronic renal failure. So and these things are happening in the younger age group. So what we say is the disability adjusted life years in Goa. Okay, so what we know that younger you are, your productivity over the period of years, if you fall sick, and especially stroke and renal failures and cardiac problems, your productivity comes down. So you're losing on a lot of economical, this thing, it's a burden on the state, it is burden on the family also. And the common things of the lifestyle diseases is that it is the faulty diet, lack of exercise, tobacco, alcohol, stress also is a factor. If we come to know, and of course we should the taper on this thing that genetic factors should not be in Goa. Many times diabetes, hypertension, we see it's coming in the families. Even cancers are also in the family. So we have to tap this reason that why is it happening at a very young age. So it is said that prevention is better than cure. If we address these issues and we come to know what is the cause of this thing, we can have a very good policy decision from the government side that we could have more parks for walking, we should control the fast food, even the schools and all, we could have a very healthy diet pattern. We can educate the people well, awareness activity also can be done. Because how much we do awareness activity, what is important is the BBC, that is the behavior change in people, and it's a very difficult thing to do. So if we have a study and we tell people this is published, you should do this is important, and few of some policies and some notifications and some control on our side also may be needed for the betterment of the public. So like just to say that tobacco rules were first formulated in the state of Goa for that purpose. And so with this I say thank you, sir.
Dr. Bandekar would like to say something since you are the senior organization.
Honorable Chief Minister of Goa, Dr. Pramod Sawant, Honorable Chief Secretary of Government of Goa, my respected Health Secretary, Dr. Dikshit, Dr. Sara, and all the dignitaries here. I personally feel the study is going to help us a lot, especially when we get such a big load of cases in my tertiary center. So if prevention component is brought in very actively in Goa health system, I think our cases where we get, nowadays we are getting very young people, young patients with myocardial infarction, basically because of this food habits. Maybe some of them, they are brought dead at the very young age, and we sometimes are left with a lot of puzzles as to why at this young age somebody's heart should fail. So we don't have systematic study. We have is the data that myocardial infarction is troubling the younger age group. Further, the main objective, the primary objective of this study is to see if there are modifiable risk factors, and if they can be modified, then we could have a healthy population in Goa. I hope this study will address all these issues, and my best wishes and my full cooperation for this study. Thank you.
Thank you, Doctor. Now I request respected Chief Secretary, sir, to say a few words.
Good morning, sir. This is a very good initiative from the public health point of view, because it helps in early intervention. So as we know the disease burden prevalent in Goa, but what we do not know is the exact etiology or the causative factor, be in terms of lifestyle issues or environmental or genetic factors. So this study will help us to pinpoint that particular thing and then devise early intervention measures, and this study should should be taken forward so that we have a good database for the future, and we can also devise public health programs based on this particular study. So with these few words, I just.
This gives me immense pleasure to say that, just mentioned that in Vasi or in Varanasi this study is being conducted, but under the pioneer leadership of our Honorable Chief Minister, Goa will be the first state where the whole population will be covered under this scheme, and sample size is 1 lakh, sir, so our population is 14 lakh and 1 lakh people will be targeted for this. So virtually we are targeting the whole household with all its vertical. So this is great achievement for the state of Goa under the leadership of our Honorable Chief Minister, sir. By this word I request Chief Minister, sir, to say.
The Longitudinal Cohort Study Goa Cares 2025, along with me, the Chief Secretary, Mr. Konkani, Health Secretary, Dr. Shekhar Sarkar, Dr. Rajesh Dixit, Dr. Sara, Dean of Goa Medical College, Dr. Mandekar, Director of Health Services, Dr. Rupa, and all other respected dignitaries, esteemed member of the Director of Health Services of the Government of Goa, the distinguished experts from the Tata Hospital and Neutral Department of the Population Health University of the Oxford, and all the present here. It gives me the immense pride to acknowledge the commendable efforts being taken to launch the large scale of the Longitudinal Cohort Study in Goa. This initiative is a major step in our commitment and efforts towards enhancing the public health and will play a pivotal role in identifying, preventing and mitigating the risk of non-communicable disease such as cancer, cardiovascular disease, diabetes, the kidney disease. The rising burden of non-communicable disease is one of the greatest healthcare challenges facing not just in India but the world. As the Chief Minister of the state, I am deeply committed to ensuring that every Goan receives the best healthcare services backed by the data-driven policy and scientific research. I am certain that this study will help us in understand the health trends specific to Goa's population and enable us to develop the targeted healthcare intervention. These initiatives will bring the multiple benefits to the Goa and serve the model for the public health research in India. Some of the key outcomes: public health impact. By studying the prevalence and determinants of the non-communicable disease, we can introduce the preventive healthcare strategies to improve the overall well-being of our citizens. Policy development. This study will generate the evidence-based recommendation that will guide our state's health policy and optimal resource allocation. Third one is the Goa-specific data. By assessing the dietary, environmental and genetic factors unique to Goa's population, we can design the tailored healthcare initiatives that strategically address the individual challenge of the local public of Goa. Global collaboration. The partnering with the Oxford University and Tata Memorial Hospital to strengthen our research credibility and open the door for the advanced medical studies in Goa. Capacity building. This study will enhance the local research capabilities as well, creating the skilled workforce in epidemiology, public health and medical research. I extend my heartfelt gratitude to Dr. Rajesh Dixit, Director of the Center of Cancer Epidemiology, Tata Memorial Hospital, and Dr. Sharayu Mhatre, the Scientific Officer of the Scientific Expertise and Commitment to shaping this groundbreaking study. Professor Sara from the Oxford University for being the part of this MOU and leading the Oxford globally recognized the expertise in epidemiology and statistic analysis. Your involvement ensures the high academic rigor and credibility for this research. With Tata Memorial Hospital and Oxford University as a key collaboration, Goa is now at the forefront of the public health research in India. This study will not only impact Goa, but set a precedent for the similar research across the nation. Under the dynamic leadership of Honorable Prime Minister Shri Narendra Modi ji, India's healthcare sector is undergoing the historic transformation. His vision for the universal health coverage is being realized through the landmark initiatives that have made the qualitative healthcare more accessible and affordable for every citizen. One of the most impactful healthcare reforms introduced by our Honorable Prime Minister is Ayushman Bharat, which aims to provide the holistic healthcare coverage across the primary, secondary and tertiary care. As a government, we are fully committed to provide the necessary resource, expertise and infrastructure to ensure the success of this landmark cohort study. We will make the special budgetary provision to support this research. The study findings will directly influence the Goa health policy, allowing us to take the proactive measures against the non-communicable diseases. We aim to make the Goa a leader in public health research, contributing to significantly in India's healthcare advancement. I once again commend the Director of Health Services for their vision and leadership in spearheading these initiatives. I extend my deepest gratitude to our partners from the Tata Memorial Hospital and Oxford University for their support in making these initiatives as real. Once again, congratulations for both the organization for supporting of the Government of Goa.
So we are thankful to our Honorable Chief Minister for blessing this project, and we are sure that it will be a pathbreaker and pathfinder for the whole health system in India. Thank you very much, sir. Thank you.
Yes, yes.
Anuj.
यशवंत दोन बुक्स घेऊन येते. Thank you. Yes. Thank you.
Thank you.